New at 11, a national $26 billion settlement with opioid manufacturers in nearly every county in the Carolinas is getting a piece. Mecklenburg County is deciding how to spend the money. WCNC Charlotte's Julia Kaufman tells us what some would like to see happen.
That money must be spent on opioid remediation activities. Doctors, as well as concerned community members, want it to go toward addiction programs for teenagers and making treatment more accessible. The opioid epidemic has claimed thousands of lives nationally and here at home.
I've lost previous students to addiction, and I don't want to lose another student.
More than 28,000 North Carolinians overdosed from 2000 to 2020. That's according to the state's Health and Human Services Department, saying prescription medications are a major driver, but so are illicit drugs like heroin.
Unfortunately, it's easier to buy and find drugs on the street than it is for you to get into treatment.
Mecklenburg County is getting $32.5 million from the settlement, the largest amount among counties in the state. Charlotte is getting $8 million. Dr. Chris Griggs with Atrium Health wants it spent partly on a mobile addiction response unit.
It's really important for us to consider starting a post-overdose response team to provide critical services outside of the walls of the hospital.
He says it'd bring treatment to people that otherwise refuse or can't afford help.
If we're going to save the most lives in our county, we need to lower the barriers to access to medicines and recovery.
Several parents and teachers hoping money goes to the Emerald School, a high school in Charlotte dedicated to teenagers with substance abuse disorders and mental illnesses.
Recovery high schools are key for early intervention.
Opioid manufacturers will pay that money over the span of 18 years. Now, local governments receiving it must report annually how it's spent. Mecklenburg County says it'll start allocating those funds in next year's budget. In Charlotte, Julia Kaufman, WCNC Charlotte.